Okay, so welcome everyone to the Undergraduate Research Education Series. Welcome back if you've attended any of these sessions before. My name is Shiver, as you probably already know, Academic Program Manager in the Office of Undergraduate Research, and I organize this series. So if you have any questions about it, let me know, message me, email me, whatever. I do want to start us off with a land acknowledgement, and then we will get to some housekeeping stuff, and then Dr. Fukushima will be moderating a conversation with Dr. Shoaf about COVID-19 researching in a pandemic. And I'm very excited about it. Okay. The American Indian Resource Center leads the way for me to acknowledge that the University of Utah, that the land that the University of Utah resides on has always been indigenous lands, specifically the lands of the Shoshone, Paiute, Goshute, and Ute tribes. And if you're not all also logging in from Salt Lake City, I encourage you to think about and get to know more information about the indigenous peoples of whatever land you are on right now. It's imperative that we acknowledge the enduring relationship that exists between indigenous peoples and their traditional territories. Through this land acknowledgement, I want to express my personal gratitude and appreciation for their persevering to protect this land for future generations. The erasure of this relationship between indigenous peoples and their traditional homelands is an insidious form of ongoing colonization, and we need to build our mindfulness of this and of other indigenous protocols. And in my opinion, the first step to respecting indigenous peoples is to give the land back. Okay, so some housekeeping things. If you are logged into this call in real time right now, your attendance is taken care of. You don't have to do anything else for that. We've got that through your login. If you're watching this video to fulfill your education series attendance requirement later, please go to the education series page and fill out that evaluation form. Put in your unit. That is the only way that I can know that you watched that video, so please do that. Yeah, I think that's it. Dr. Fukushima, are you ready?
Yes, I am. So lovely to see folks. And we know that this event is being recorded, so we know that other folks will be tuning in when they have a chance. And that is the wonderful world of how technology has allowed us to adapt to make programming available to more. And so we're so happy to have you all here. I'm really honored to have Dr. Kimberley Shoaf here joining us, who really is an expert on thinking about public health, as well as responding to a range of crises. And so we are joined here by Dr. Kimberley Shoaf, who is a professor in the Division of Public Health and Associate Chief for Community Engaged Scholarship. She has more than 30 years of experience in public health practice, including experience as a health educator, trainer, and researcher. And her bio is very long, and we can just go ahead and plug into the chat, where you can check out the extensive experiences that Dr. Shoaf comes into this conversation with. And so I just wanted to thank Dr. Shoaf for joining us. A couple of logistical things for our audience tuning in is that if you are not a speaker, you all have your cameras off, so I appreciate that. And I encourage us to join with empathy and compassion, and with a commitment to our collective learning, and that, if you have questions, as Dr. Shoaf is responding to a variety of questions, please go ahead and put it in the chat. We will also open it up for dialogue. We see all of you as an important part of this conversation. And so before I proceed, I just wanted to check in to see if there's any questions about format. I will take your unmuted buttons as a sign as no, but you can go ahead if you have any other questions or needs as we proceed, go ahead and put it in the chat. And so I am going to start with and I know we are in this interesting moment when we had organized this conversation. We had Omicron on the rise, and now there's other variants that we may have to pay attention to, as well as a range of other events that might be impacting our world. And so when we think about this conversation today around research and COVID-19, and doing research during pandemics, I also hope that we'll, think together about like how this is also relevant to a range of other urgencies that might be impacting our communities. That global pandemic is just one of the many crises that might impact and shape our lives that Dr. Shoaf is very well aware of and very much on the front lines thinking about. So you have a strong record, Dr. Shoaf, of participating in research teams, utilizing mixed methods to understand public health response to emergencies and disasters. So if you could tell us a story, what is your story behind doing this work? What led you to go into this, this field of responding, being a researcher and somebody who's working on the front lines of public health crises?
So that's a really great question, and I like sharing my story of how I got here. So like many people, as an undergraduate here at the University of Utah, I was a pre-med student. Like many people, I think when we come to college, we think, oh, we're going to be doctors, and I was one of those. I was a pre-med student and majoring in health promotion, health education in the College of Health. As time went on, through my undergraduate, I realized that I was actually more interested in population level health, public health, than I was actually in practicing medicine. I still thought maybe someday I would practice medicine, but thought I really enjoy working with populations. I had served a mission in Latin America, in Peru, and loved doing, and I did a lot of health related work during that time that I was in Peru. And I really enjoyed what I saw in terms of being able to help whole populations improve their health status, and not just one by one treating people who were sick. And so I went on to do my graduate work and focusing primarily on Latin America, as I really enjoyed my time in Latin America and was fluent in Spanish and thought this is a great opportunity. Did a master's of public health at UCLA, at the Fielding School of Public Health at UCLA, and then went on to do my doctorate also at UCLA. And while I was in the middle of my doctorate, I was getting ready to do my dissertation data collection and was working on writing a proposal to do primary data collection, looking at qualitative research in Peru, looking at natural family planning methods, and in the rural mountains of Peru, had planned to. I had planned to take my baby. I was pregnant at the time, and planned to take my baby with me on my back to do that data collection. As lots of researchers do, and as the women there in Peru do, put their baby on their backs and just go about their daily business, but ended up having twins instead of one baby, and didn't think I could put two babies on my back. So I had to sort of put a little bit of hold on that. And in the meantime, I started working with a researcher at the Fielding School of Public Health who had done some research on a variety of earthquakes in California. And I was really interested in that because when I was thinking about medicine, I was really interested in emergency medicine. I had been an EMT, worked for a volunteer ambulance service back in my hometown in Pennsylvania, and thought, well, there's a lot here that sort of the earthquake stuff and emergency medicine and public health sort of merge together and do so nicely. So started working on some of those data sets. And then just as I was about ready to write my proposal based on those data sets, the Northridge earthquake occurred in Southern California. So early on Martin Luther King Day in 1994, at 4:30 in the morning, we were all shaken out of our beds in Los Angeles. And as soon as I got my 2-year-old twins settled down and realized that we were all safe, I called my advisor and it said, this is it. I'm hooked. I'm done. Disasters are now my life. Let's get a grant and study this, and we'll make this my dissertation. And that's what happened. And from that point on, I've really focused most of my research and teaching on disasters. I still do some other general public health research, but the majority of my research is really on disasters.
Oh, thank you for sharing that. That's so wonderful to see how a range of, I think life experiences, you had a range of life experience before you arrived at the role that you're in now. And I think that's super interesting and super important for students to hear, is that our road to where we are can have many paths. And so that's super exciting. And yeah, so as many people may be running away from disaster, here you are running towards it. I love it. Yeah, that's so interesting. Well, I think that, one of the things that, comes up then, in this next question that we wanted to think about, because, here you are doing research in disaster context, have a very long record of doing that. And, I know that in particular, our students who are tuning in, or other folks who might be tuning in, are seeing that, we're in a particular moment of where we've seen global pandemic as a particular kind of disaster shape our lives, where it led to policies and changes in life practices, right? From masking to shelter in place or stay-at-home orders. And so there's a range of things that have impacted our lives. And I guess one of the things that, I wanted to hear you reflect on more is, thinking about the work of disaster and research. How do these policies impact the researcher? And, what policies have been useful? And yeah, just kind of from a policy perspective, I know you're probably on the front line shaping policies. And so I would love to hear you talk about the relationship between policy, disaster, and research.
Yeah, so it really is, it's fascinating. And being on the front line, I have been on the front line during this pandemic, and it's been quite interesting. I tell people all the time that I wasn't certain that, being an academic sometimes removes you a little bit from that front line. And I wasn't sure I was ever going to go back to being a practitioner. But this pandemic has sort of pulled me back, even if the majority of my work, my practice-based work, has been helping to develop and implement those policies here on our campus. So I've led the health and safety response for the campus for COVID, made recommendations for policies. And it's a really good question to think about how science actually affects policy and vice versa. One of the things that is important as scientists and as future scientists is to really think about how your science is going to be translated into practice at some point in time. And researchers, when we look at that trajectory of research, we have everything from very basic bench research that is really interesting and novel and cutting edge. And then there's at the other end, very practice-based research, very applied research. And all of that research is important. And it's important that the research that is on that left-hand side of that very basic research, that when that basic research is successful, that I get moved along that line, that continuum up through that translation, and that translation not get lost. And so it's important that we have researchers that understand practice and can actually translate that research into practice. And it takes not just understanding that, but it also takes relationships with the policymakers. And so through the pandemic, it's been very important. I've had, because I'm very much a practice-based researcher, I have had relationships with the public health officials, both in California when I was there, as well as in Utah and in Nevada and other areas here in the western part of the United States, where I've worked with those public health officials, so that my research directly translates into practice. Even if you are going to go into a kind of research that's not that, make sure you create those relationships along the way so that your research can be implemented as policy. The pandemic has been particularly difficult for public health researchers and for the public health practice community, because we sort of lost the last step of that translation, and that's in creating those relationships with our elected officials. And those relationships between the public health practice community, the public health researchers, and those elected officials really took a big hit during this pandemic. That communication was not strong. There wasn't a great deal of trust. And we're starting to see now, we really need to rebuild that, because we can't continue to have public health isolated from our elected officials. We need to create those relationships. So I think that's a really important piece, is making those relationships across the research continuum to the practice community and to our elected officials, so that we have that continuing piece.
Great, that's so wonderful. And I think that whatever, folks are researching, we can really identify with that spectrum that you're referring to. That's so wonderfully put. I'd love if you could also think about, or help us think about, because you're in the front line, and here you've described you've done research during, earthquake, context, as well as there's a lot of urgency and disaster context you've worked in. And so I'm wondering, when you think about your own safety as a researcher, what does that look like? What are the protocols? How do you go about establishing safety for you as a researcher, your team, the community that you're working with? I'd love for you to think about that. I mean, in the context of global pandemic, or other examples too.
Absolutely. And we talk about during my career, there has been a program where we look at disaster resistance research and disaster resistant universities, because it wasn't something that was thought about in terms of how do we maintain our research during a disaster. And so there's a lot of a thought process that needs to go into that, and not all it's not something that researchers are inherently trained to do. And so there are some basic things that you need to think about anytime. First of all, just like in your personal life, that you should have a disaster plan and a disaster kit for your personal life. You should have one of those for your professional life as well. So as you become a researcher, that you have a plan for, if something happens while I'm in this building, if there's a fire, do I know where to go? If there's an earthquake, do I know what to do? Do I have all of those immediate steps that I need to have? Do I have supplies ready to be able to take care of any problem that happens? And that's always the first priority, is to make sure that you and your research team are safe. And so take all of those same steps that you take for your home, for your workplace. The second piece is then, well, what about my research? And how do we deal with that? And some of that are the same types of things that we talk about in terms of sort of data safety and security, right? Backing up data, having that, having your data stored someplace else, not just on your laptop or just on your desktop computer, that it's backed up to the cloud. I also still recommend people have a backup stored someplace else, a physical backup that they do less frequently than you back up to the cloud, but maybe every couple of months, back everything up to a hard drive, to an external hard drive that you store at home or someplace else, so that your data doesn't get lost. Research continuity is really important. So that's the data piece. There's also thinking about in labs, if you've got refrigerators and you've got, if you're doing biological work or something where you've got refrigerators, making sure that you've got power backup for those things. Here in our building, I lead the safety team for our building. Imagine that. I do that. And we talk about things like, we have battery backups for both for our servers as well as for our internet access, so that our Wi-Fi doesn't go down, so that if we can't use our desktop computers because we don't have power, we can use our laptop computers and still connect to the Wi-Fi in the building. So, just thinking about some of those basic things in terms of ensuring that your data and your research is not interrupted or destroyed. Sometimes we are actually in the field when that happens, and we may be doing field research someplace else in the United States or in other countries. And that's a really important thing to think about anytime we travel for the university, whether it's domestically or internationally. We should be thinking about what happens if something happens while I'm there. Can I get home? Can I get healthcare where I am? Can I be safe? How do I let people know that I'm fine? And really have those plans. In our department, we actually do learning abroads. We do three or four different learning abroads that come out of our department, out of our public health division. And we have plans. For example, we generally do not send a team without having two faculty. So in case something happens to one, we've got somebody else to take care of them. Or if something happens to a student that, one faculty has to stay with them, we've got somebody else to take care of the team. We always have people in our department that are prepared to be able to go globally. So when we have other faculty that aren't traveling, that have visas to the countries where those people are traveling, so that if we need to get there to help them, support them, we can do that. So it really is just sort of that whole thought process of what ifs. And, think about the worst thing that can happen and plan for that. And if you plan for that, you'll be pretty much okay if something less bad happens.
Yeah, and that's great. You all probably were much more prepared to adjust when the global pandemic happened, and everyone was thinking about remote, different kinds of engagement and research. It literally changed the way many of us conduct interviews and do focus groups now. I've done now multiple Zoom interviews and focus groups. Yeah, it's like different events can alter literally your research plan. Yeah, that's so important to think about it in that context. I'd love if you could share with us, so tell us about a scenario where your research was impacted by disaster, and then what did you do?
So we had some funding we were looking at the response to disasters in nursing homes. And we were looking at nursing homes in Florida during the hurricane season in Florida. And this was during during the most active hurricane season, where they had, I believe that was 6 hurricanes hit Florida in that season that made landfall in Florida and actually did damage. It was the most active season that we've ever had in the state of Florida. And we sent a team out. It was quick response research. So we were basically needed to be in the field within a week of the hurricane hitting. And we had everything ready, and we got out to the field. We got our research team out to the field. And as they were starting to do the interviews with the various nursing homes that we were working with them, from our offices, contacting nursing homes saying, okay, they'll be there tomorrow. Can they come interview you at 2, right? And we were scheduling those interviews. And as they were doing these interviews, a new hurricane developed off the coast and they had 3 days for the next hurricane to hit. And we had planned for that scenario a little bit, sort of, oh yeah, well, what if another one hits? Well, okay, we'll get out and we'll change our tickets. And we made sure that their tickets were changeable tickets, that they could change their flights. They did one more day. They knew that they were going to have to evacuate because the area where they were was going to be hit again. And so that's one thing is the first thing is to always follow whatever the local people tell you, whatever the local officials tell you, you need to comply. You need, your research is not more important than your safety or the safety of the people around you. And so we planned to get them out. They were gonna leave the next day. And the next day came and the flights were all canceled. And so it was really a matter of, okay, you're just going to have to buckle down there. You're going to have to shelter in place. And as soon as we can get you on a flight out of there, we'll get you on a flight out of there. And they had, they had things with them. My colleague that was in the field at the time with a student doing this data collection, she has done research in war-torn areas. She did a lot of work in Armenia and in Azerbaijan and in Nagorno-Karabakh, which is the Armenian community within Azerbaijan during the war. And so had a lot of experience with being in those kinds of situations. She was very prepared. She kept the student calm, and they were able to do that. Similarly, I was in Peru on a post-earthquake reconnaissance trip on September 11th, 2001, with a group of doctoral students. And so it really is a matter of just being able to be flexible, be respectful of what's going on at the time and what's going on around you, as well as being very respectful and mindful of your own safety, your own sense of security, whether that's physical security or emotional security. For me and the students in Peru at that time, we were physically safe. We were in Peru, but we were uncertain about our families. We were uncertain about what was going on in our homes. We were getting all kinds of information, and a lot of that then at that point in time resulted to self-care and mental health care, and really, being able to focus on what we were going through emotionally at that point in time, and allow the physical circumstances to just sort of be. We found an American restaurant on the beach in Lima, and we sat there. We sat there at that American restaurant with our compatriots, and allowed that to really be our way of, decompressing and processing those emotions that we were feeling at that time.
I love it. And that's so important to kind of remind folks, right, about is that there's the physical dangers, but then there's the ways that it's impacting us emotionally and mentally, and how we take care of that. And so it sounds like you all did what you needed to do. And I'm sure it was ongoing too. It wasn't just that, that one time sitting together. It must have been ongoing to take care of that emotional and mental wellness. Yeah, thank you for that. That's so, wow. Your stories are amazing. I'd like us to now think about some scenarios that are just practical that, if this happens, what you recommend people do. And so, we have a lot of pandemic scenarios that I think right now people might be feeling some reprieve from, with numbers going down, but we just don't know, right? There could be another variant. There could be something else that is not COVID-19. And so, yeah, there's being prepared is important. So I'd love if you could tell us, what do you do if someone in your research team gets sick?
So certainly we have experienced this over the last 2 years. We've experienced this across the campus. The first thing, and from my perspective, as I said, with other things, it's always people first. So that's, the research is not as important as the people. No matter how much, and that gets really hard, like when you're a doctoral student and you're doing your dissertation research and you're like, no, that's the most vital thing on the face of the earth. No, the people around us are the most important thing. So the first thing is to really make sure that that person is okay and that they get the care that they need. With COVID, if somebody gets sick and they have been on campus, and if anybody on campus that gets sick should be reporting, we've got the information on the coronavirus website, so coronavirus.utah.edu. They should be self-reporting, get tested, and report those results of those tests. We have testing on campus, and we will continue to have testing on campus as long as COVID is a problem. We will continue to have testing on campus. So that's the first thing. Go ahead.
Keep going. Did you say more? Go ahead.
Okay. So that's the first thing, is to make sure that they get the care that they need and that they report that infection. Our contact tracing team then will reach out, and they'll reach out to that person, and then they will reach out to the people that were around that person. So if you're asked to quarantine, do that. If you're asked to, we enroll pretty much everybody who's been exposed to somebody who it tests positive. We enroll them in active monitoring. And so you'll get text messages 3 times a day. If you don't respond to the first one, you get a second one. If you don't respond to that one, you get a third one. So respond to the first one. That way we won't keep bugging you, to make sure that you stay safe. We have found that, people that have been exposed do convert. And if they're quarantining, as they've been asked to do, then they're not going to then expose somebody else. So that's really important to follow those policies. For the most part with COVID, we don't worry so much about cleaning surfaces and things like that. Close their office door, don't go in there for 24 hours, and then it should be fine after that. So it really is just following those basic policies that we have on campus, but following up and making sure that the person's getting what they need.
Fabulous. And you've already started to talk about, travel and safety and all that, but maybe if you could talk a little bit more about is, say you're a researcher and you've traveled somewhere, whether it's abroad or to another state or another town that's not, easy for you to get back home, and you contract COVID-19. What is the best practice for somebody to do in conditions like that?
So as a researcher, if you're traveling with your research with the university, all travel should be going through the university travel offices. And those university travel offices include the ability to change flights and get people back. So it's really important that that happens. So the first thing really is to let the university know that that's happened, and work with the university travel office to be able to solve those travel issues, right, that are associated with it. If you're sick, you're not going to get back on a plane. So you need to find a place you need to stay, and the university, travel office will help you. You'll need to be able to extend your hotel, and be able to take care of that. Health insurance is really important, and making sure your health insurance will cover you when you're traveling. So before you travel, make sure that your health insurance will cover you wherever you're traveling to. If you're traveling internationally, we register our travel in our international travel from the university through the Office of Global Engagement, through risk management, and we purchase travel insurance, which allows that travel insurance make sure that you're going to be covered for any health issues while you're overseas, and can pay for repatriation, basically medical airlift back to the United States for care, particularly if you're someplace where there isn't good medical care, where the medical care may not be the quality that you would get here.
Excellent. Thanks for reminding us about those things. I'm dropping in links because I'm like, yeah, those are really important resources that we need to be capturing and saving as well for our team to make sure we have on our website. So we'll make sure to collect those and make it readily available to remind folks. What happens if you're doing interviews and you find out your subject has COVID-19? What do you do?
And we've had some of those cases too during the pandemic. I have a colleague here who does sleep research, and she's continued to do some in-person research during the pandemic. And so it's basically to ensure that they report if they get sick within 2 days of any research visit, so that the researchers know that they've been exposed. And then they've been exposed, they follow those same procedures and guidelines that we have for everybody on campus. In order to do in-person research, I recommend that even though the university cannot require masking and distancing, if we are doing in-person research and you are actually, face-to-face with somebody from the community, as long as we have elevated numbers, and while our numbers are a little bit lower right now, I can pretty much guarantee they will go back up again Unfortunately, they may be in the next few weeks as BA2 is starting to rise across the country. And so I highly recommend that any in-person research that masks are worn if you're going to be in close contact. Even if you're in a room with, if you're doing like a focus group in a room with, 10 other people, even if you space out, it's still best to have a mask, have a face covering, because you don't know. You may have been exposed and be incubating, or they may. And so it's just best to protect everybody, even if, that's not what most people are doing. Just think about all of those procedures and think about, you may be interacting with people that are at high risk, and you want to protect them and you want to protect your team as much as possible.
For sure. That's really important. Thank you for reminding us about that. So now we'd like to think about disasters and disaster zones, which you have worked in, and actually anywhere can become a disaster zone, right? I mean,
that's right.
But when you are working in one in particular that that there's something abound, and that you might be in, you talked about, this hurricane, experiencing hurricanes and preparing for that. Is there anything else you'd recommend that folks might want to think about in addition to return tickets, safety planning, having a plan? Is there anything else you'd like to have them think about with regards to that?
So one of the things that if you're going into some place that has recently had a disaster and you're going in to do research, one of the things is to not interfere with the response that's going on, and to be sure that you are able to take care of yourself. When we send in teams, I belong to the Earthquake Engineering Research Institute, and when we send out teams to do reconnaissance missions in the first 5 to 7 days after a major earthquake has occurred, and we basically tell those teams that they need to be self-sufficient. They need to be able to take care of themselves and not depend on the local community to take care of them. That means, where are you going to sleep? How are you going to do that? How are you going to feed yourself? How are you going to take care of all of your needs, your personal needs? And really think of it as like, I'm going on an extended backpacking trip and I'm going to take care of myself out in the wilderness. Think about that. And so if you're going someplace that is prone to disasters, similarly, be prepared. I always travel with a filter, with a water filter, so that no matter where I go, I'm traveling to Europe, I take a water filter with me. Even though Europe's water is fine, you never know when something's going to happen. So just think about that sort of preparedness when you're traveling as well. And then if something is predicted to happen, if you can get out of there before it hits, that's your best option. Even though it's like, well, but this is what I'm going to study. No, get out of there until they can resolve the situation. You don't want to be an added burden on the community that's been hit by a disaster.
Wow. Well, you've told us some really important, enlightening, strategies that we should all be thinking about in all of our research. And I would love to, I'm going to ask the last question, then we'll open it up. And the last question, I think, is really important to reflect on. And I'm so excited to hear your perspective, but what keeps you hopeful? You are doing some really important on the ground, thinking about disaster, thinking about worst case scenarios. And so what keeps you hopeful? How do you take care of yourself, and how do you keep doing this important work that is really for all of our collective wellness? Yeah.
That question about being hopeful, it's sometimes hard. It's been particularly hard with the pandemic for me, particularly when I've seen, people not listen to the science that we've been putting out, right? That's been difficult. But then something happens and somebody listens and somebody, and that really is that's part of how we just, I just keep it up is by seeing those tiny steps. I'm currently doing an after action review for Salt Lake County Health Department for their pandemic response, and working with them, been doing focus groups and listening to their stories. Actually is incredibly uplifting. And that's another piece of it. The work that I've done after hurricanes, after earthquakes, and really listening to the stories of the people who have been, of the responders in a lot of times, and listening to their stories and the things that they've done, and really see how the research that I've done impacts their ability to do their work. And that's something that, regardless of what kind of research you're doing, it's not unusual in public health to get sort of a little dejected, whether you're doing disasters or you're doing something else in public health. Prior to doing this, I was a health educator, and I worked a lot I was working in HIV. And I was working in HIV at the time of the HIV epidemic. And many of my colleagues were dying. And that was a horrible time for the HIV community. And, the community of researchers and people that were working in that field came together on a regular basis and processed that. It wasn't a field for me. It was too hard for me to be able to deal with that. And I had to recognize that. And I kind of stepped out of it and turned to something a little bit different. And so I think that's part of it, is just finding your niche. And I'm a little bit of an adrenaline junkie. And so, that fast pace of that response and getting that research out in the field is actually quite uplifting for me. And so, find your passion. I think that's part of it is, if you can find your passion in what you're doing, and just allow yourself to reflect on what have I accomplished. And, I've had a pretty long career so far. I hope it goes on for another few years, but, things have changed a lot during my career, and I've been a part of that, and that's incredibly rewarding.
Oh, that's so lovely. Well, thank you for that, and for reflecting on the rewards of doing this kind of work. I have so much respect for all that you do, and I'm so grateful for your recommendations. Yeah, I would love to take this as an opportunity now to open it up to our audience who's been able to join us in person, or in person, I mean by Zoom. And so if we could use a chat function, you can go ahead and chat your question, or you can do the signal of I have a question by just simply unmuting yourself, and that will tell me that you want to ask. You can also raise your hand if you prefer to raise your hand, and I'll go ahead and call on you. So to the audience, questions for Dr. Shoaf.
Don't be shy. I answer all questions.
Here's your chance to ask a question of the person who has been defining policy and practice with pandemic response at the U. Any questions?
Who has impacted your life for the last 2 years?
Yeah, or if you want to make a comment, things that came up for you, can also make a comment. We welcome comments. Maybe you don't have a question and you just have a reflection.
Maybe I can ask a question.
Here we go.
There we go.
Thank you, Tyler. If you go by Tyler, thanks for kicking us off. Go ahead.
Yeah, I was just wondering, I mean, you kind of touched on a lot of this already, but what do you, or what would you say has been like the most difficult part about trying to communicate a lot of really the research about COVID-19 over the last, what now, 2 years, and like trying to communicate it in terms that I guess like the general population can really understand, I guess.
Thanks. That's a great question. I will tell you, the communication in all disasters, communication is the most important piece, and it's often the piece that breaks first. And when responses don't go well, it's generally because of communication. And I think that from a research perspective, that's particularly important. We know that science changes. And in something as novel as this coronavirus pandemic has been, science can sometimes change rapidly. And it's really hard to communicate science quickly and simply, particularly when what we know changes sometimes on a daily basis. And so I would say that that's been our biggest issue in communicating the science, is communicating the uncertainty around what we know, and doing that in a way that doesn't undermine what we do know. And that's a case with a lot of different disasters. And a lot of different issues, not just the pandemic, but being able to communicate that this is what we know today. We are continuing to explore, we're continuing to study, we're continuing to analyze. When things change, we will tell you that they have changed and why we've changed our perspective on this. And I don't think we've done a great job of that in communicating that to the general public. So that's a great question.
Thank you. Thank you for that, Tyler. Did you have additional questions, or we have a question in the chat that I'll turn to, but I just want to check in if anyone wanted to unmute themselves. Tyler, go ahead.
Yeah, I was actually just going to ask a follow-up question to that really quick. So I personally have a lot of family members that have had a difficult time, I guess, trusting or listening to some of the research surrounding the pandemic, especially over the last year, really. They were pretty good about listening to it for the first 6 months to a year, but I think that they've kind of gotten a little bit, I guess, tired of things changing. And so I was just wondering, how would you say would be best to communicate stuff like that to them about why even though guidelines might be changing, why we still need to be vigilant and whatnot and following those?
Yeah, that's a great question. When we do risk communication, and I've done some research on risk communication and communicating during disasters and information. One of the most important pieces is having empathy for them, and realizing where they're coming from. I think that's been difficult for all of us during the pandemic, is, having a bit of empathy when people are saying, no, you're just lying, or you're, oh, you just wanted to go on so that you get money for it or whatever. Yeah, if they only saw the amount of research money that we actually have on these things, it's not making any of us rich. But really having empathy for them and understanding where they're coming from. And there's some really great examples of risk communication that demonstrate that. That has not happened a whole lot during this pandemic, unfortunately, from the communicators. And so from a personal perspective is really recognizing where they're coming from, and allowing them the autonomy to make those decisions, but also allowing yourself the autonomy to be able to protect yourself when you're interacting with them. So for example, working with some of the people on the campus that were very hesitant about getting the vaccine, and they felt that they were being shamed into getting vaccinated and they were going to be ostracized. I met with a group of these students, and I said to them, no, you have the right. We in Utah, we got an exemption. You have the right to claim an exemption. I would strongly encourage you to get vaccinated, but you are in charge of your body, and you get to make those decisions. And they were so incredibly grateful. They said I was the first person that ever told them that. Out of all the people who are telling them they have to get vaccinated, they have to get vaccinated. And I thought how sad that is, right? So it really is recognizing them as human beings, and that they have autonomy over their own bodies and their own lives, but also helping them recognize that you have that same autonomy over your body and your life. And your interactions with them may vary because of whether or not they're taking the actions that may or may not, that may put you at risk.
Thank you for that. Such important questions. I appreciate, Tyler, your question also showing how research impacts our personal lives, right? And how we have an opportunity to ask questions here. Other questions from the audience? We do have one in the chat. You can just unmute yourself. So I'll start reading this one. If you're ready to go, we can have yours follow up after. Are there any good resources or tips you have for preparing emergency plans for both personal and professional aspects? I find myself overwhelmed by the idea of how much there is to do, and it's hard to get started as a result.
Yeah, there's a lot of information out there. I have an entire Pinterest page that's got thousands and thousands and thousands of posts of disaster preparedness sites. And I read them just because I want to see, what information is being put out there. And try and correct any wrong information. Your best resource is actually is ready.gov, which has a lot of information about preparing for emergencies, including looking at things like 4-day disaster kits. We used to call them 72-hour kits. We recognize that you probably need somewhere between 4 to 7 days worth of supplies that you can readily access and take with you if you need to. I use a rule of 7 days, 2 weeks, 3 months, 1 year. So 7 days worth of stuff that you can take with you in case you need to evacuate where you are. You need to go to a shelter. They may or may not have resources at the shelter. So things that you're going to need to get you through those first 7 days, sort of bare basics, right? To get you through 7 days. The second step of that is 2 weeks, and think about having enough if you are, for whatever reason, because you're on, under quarantine, because there's a power outage or there's a big snowstorm and you're snowed in, whatever, that's 2 weeks within your household to be able to survive, live in your household for 2 weeks, generally without power, and being able to prepare foods that you have available in your pantry. And things to keep yourself warm. Think about Maslow's hierarchy, right? You need shelter, you need water, you need food, you need, those things that you absolutely need, and think about it from that perspective. Then I look at 3 months, and 3 months is 12 weeks is what we have looked at in terms of, for example, pandemics. Oftentimes those waves, if we think back, those waves sort of start and end, and it's a maximum of 3 months. So have bare minimum to be able to supplement what you have for those 2 weeks and get to 3 months. And then once you get there, then you can start thinking about, apocalyptic type events and preparing beyond that. Think of 7 days, 2 weeks, 3 months to be able to get through those things. And just think about, if you think about Maslow's hierarchy, and the basic things that you need to survive and to be, I like to say, not just survive, but thrive. That'll help you really get through that.
Wonderful. Well, we are at the hour, and I just want to make sure that we also make sure Shiver can come back with final logistics, final recommendations. So I'm going to hand it back to my colleague Shiver, who's going to wrap things up. And if you had a question that didn't get answered, then please go ahead and put it in the chat, and we can make sure Dr. Shoaf gets your question, and we have those responses available to you. And so I just want to thank you, Dr. Shoaf, for your you're amazing. You're a rock star.
Thank you.
And so I'm just so in awe of all you do. I want to hang out with you all the time. I'm going to pass it over to Shiver.
Well, I would like to echo that. I also think you're amazing and want to hang out all the time. You just got 2 new best friends. To wrap up the event, though, I want to thank Dr. Shoaf for your stories and your wisdom, and Dr. Fukushima for facilitating this wonderful conversation. And I want to thank the folks watching in real time and anybody watching the video later. Thank you for coming and participating in the education series. For students who have logged in real time to this Zoom call, your attendance has already been taken care of. Your login counts for that, so you don't have to do anything else. I have, however, dropped the link to the Education Series evaluation form into the chat. Your feedback is always welcome and helpful to us, so it's not required for those of you attending in real time, but we would love it if you did fill it out. For those of you watching the video later for your Education Series attendance, please go to the top of the Education Series page and fill out that evaluation form with your units so that I can track that attendance. And with that, I'm going to stop recording